If you're getting ready for the NCLEX, you know there's one skill you absolutely have to nail: med calculations. And look, this isn't just about passing a test. This is really at the heart of being a safe, effective nurse. So let's just dive right in and get this mastered. I want to start with this right here, because this is the absolute bottom line. I want this to sink in. This single sentence really highlights the enormous responsibility that you hold in your hands with every single medication you give. It's why getting these calculations perfect isn't just a good idea, it is completely non-negotiable.
So, how are we going to do this? Well, we're going to build your confidence from the ground up, kind of like a pyramid. We'll start with a solid base of safety, then add the language of measurements and tools. After that, we'll hit the formulas, and then we'll finish up with a final check, layer by solid layer. Okay, first things first, our foundation. Before we even think about crunching a single number, we have to be grounded in the principles of patient safety and our own professional responsibility. Every single calculation you ever do starts and ends right here. Think of this as your mental checklist, your ultimate safety net. Before you do anything at all, you have to run through these 6 rights. Do I have the right medication for the right client? Is it the right dose, the right route, at the right time? And will I do the right documentation? This is the bedrock of safe practice. And here it is again, the most crucial takeaway. Your nursing license, and more importantly, your patient safety, literally depends on you being the final checkpoint. If a prescription or a dose looks off, your job is to stop and question it. Always, always question. Never just blindly administer. All right, let's move up to the next layer of our pyramid. To do the math right, you have to speak the language. And in the world of medicine, that language is the metric system. There's a really good reason the metric system is the standard everywhere. It's just so simple. It's all based on units of 10. Once you get a handle on the basic units, grams for mass, liters for volume, you're well on your way to becoming fluent. Okay, listen up, because this is probably one of the best little tricks you can learn. Forget doing complicated math in your head. Just remember this super simple rule. Going from a larger unit to a smaller one, just move the decimal 3 places to the right. Going from smaller to larger, you guessed it, move it 3 places to the left. That's it. That's the core of most conversions you'll do. And here's that exact rule in action. Look, 1 gram is 1,000 milligrams. 1 liter is 1,000 milliliters. See, it's all about that power of 1,000, which is why we're just hopping that decimal point 3 spots. You're going to see these equivalents absolutely everywhere, so get really comfortable with them. Hey, quick but really important tip for the exam. Focus your energy on learning the generic names for drugs. The NCLEX isn't going to try to trick you with brand names, so you can channel all that study power where it really counts.
All right, we've got the safety foundation and we've got the language down. So now let's connect all those numbers and concepts to the real-world tools and techniques you're going to be using every single day at the bedside. Now, oral meds might seem pretty straightforward, but a lot of errors can happen here. So remember these golden rules. Number 1, never ever crush tablets that are enteric-coated or say sustained release. And when you're measuring liquids, always put the cup on a flat surface and get down to read it at eye level. That's how you ensure accuracy. When it comes to injections, the angle is everything. It's what determines if the medicine gets to the right tissue layer. So for intradermal, you're going in really shallow, like 10 to 15 degrees. For subcutaneous, it's 45 or 90 degrees. And for intramuscular, you go straight in at a 90-degree angle. And just as important as the angle is the volume. Your muscles can handle a lot more fluid than the fatty tissue just under your skin. So a good rule of thumb is no more than 3 milliliters for an IM injection, and actually only 2 milliliters for the smaller deltoid muscle, and a max of just 1 milliliter for any subcutaneous shot. This is so important. You have to know your syringes. A tuberculin syringe is what you use for tiny, super precise doses, and it's measured in milliliters. An insulin syringe is only for insulin, and it's measured in units. I can't stress this enough. Mixing these two up is one of the most dangerous medication errors a nurse can make. And speaking of insulin, here is a fantastic little mnemonic that will save you. When you have to mix insulins, just think RN. You draw up the regular insulin, that's the clear one, before you draw up the NPH, the cloudy one. R before N. Simple, safe, and super easy to remember.
And here we are. We've reached the very top of our pyramid. We have our foundation of safety, we're speaking the language of the metric system, and we know our tools. So now it is finally time to put it all together and actually do the math.
Okay, this formula is going to be your best friend. You'll use it constantly. It's simply what you desire to give the patient, divided by what you have on hand, and then you multiply that by the quantity it comes in, like per 1 tablet or per 1 ml. That simple equation gets you the exact dose you need to give.
Now, for IVs, the formula looks a little different. You take the total volume in the bag, you multiply it by the drop factor, which is just how many drops it takes to make a milliliter for that specific tubing, and then you divide all of that by the total time in minutes. And boom, that gives you your target drops per minute. But here is a safety rule that is even more important than the math itself. Never, ever speed up an IV just to catch up. You could cause fluid overload and do serious harm to your patient. If an infusion is behind, you document it and you talk to the provider. Patient safety always comes before the schedule. Okay, so we've covered all the theory. The final and maybe most important step is applying all this knowledge with practice and, of course, with sound clinical judgment. Because remember, the math is only one part of your job. All right, let's put this to the test with a classic NCLEX-style problem. The order is for a heparin drip at 1,000 units an hour. The bag you have from pharmacy is 500 ml with 20,000 units of heparin in it. So what rate in milliliters per hour are you going to set the IV pump to? Go ahead, take a second, think it through. Did you get 25 ml per hour? If so, great job. Let's just quickly break down how we got there. First, you have to figure out the concentration you have on hand. So you take the 20,000 units and divide it by the 500 milliliters, which gives you 40 units per ml. Now you use the formula, your desired dose, 1,000 units an hour, divided by the concentration of 40 units per ml, gives you your answer, 25 ml per hour. Okay, let's end on this one last thought. Your math works out perfectly, and it tells you to give the patient 4 tablets of a medication. Now, the calculation might be right, but what's your next step? It's to stop and ask yourself, does this feel right? Is giving 4 pills at once a normal dose? That final gut check, that moment of clinical judgment where you pause and double-check anything that seems unusual, that is what makes a good nurse a truly great and safe nurse.